Hey nurses, so today we are going to discuss NCLEX next gen question, and I'll keep discussing such questions regularly on this channel. So you can subscribe to this channel and keep following. I know this is one area in which most nurses find difficulty, so I'll try to do my best. But let me tell you that in such type of questions, usually a case scenario is given, which is followed by either a single question or sometimes there are six questions following the case scenario. However, in this kind of setup, I'll be able to take up only one question at a time after the case scenario, but still, it will help you a lot. So, the question is the nurse is caring for a 28-year-old client. The history is the client was brought to the emergency department, you can see, after causing a disturbance at school. So, while reading the question, just keep in mind or make note of important points about the patient. The client states, I have to finish this project because I will develop a cure for all cancers, which means he is a little in a hyper delusional state. Then, client verbalizes having endless energy and a million ideas and reports feeling self conscious about an upcoming project and wanting to make sure that the work is perfect. So he's over, like you can say, obsessed with that work. Maybe that work is not existing also. So he has that hyper state going on. Client has slept only 1 to 2 hours a night for the past several days, reporting being too busy to sleep. And last meal was 2 days ago. So you can see he has deprived himself of food as well as sleep. The client appears excessively thin and disheveled. So, because of these things, lack of sleep, lack of food, his health has started deteriorating, and which is visible also. The client is easily agitated when interrupted and jumps from one topic to another. Client became increasingly agitated mid interview, yelling, I don't have time for all these questions. I have work to do. During the completion of interview, the client shoved the chair and left the room. So you can see in this second paragraph of question, his agitation is increasing and increasing while the interviewer is still talking to him. And his admission weight is 59 kg. He's 28 years old. Okay. So these are the highlighted points are the ones which are important to take note of. Now, which client finding requires immediate follow up? Agitation, physical appearance, last meal 2 days ago, or sleep deprivation. So you can see immediate word has been highlighted. And if we look at the options, we might feel that all four are equally important because sleep deprivation is too much. It is extremely less amount of sleep he's taking. If we talk about meals, that is also 2 days ago. So that is kind of severe stage for both of these. So we might feel that which option should we choose then if everything is such severely impacted in this patient. So in such type of questions, with that formula which you have to use is, which I've mentioned in my reels also if you are following me on Instagram, whenever you are confused, you have to choose that option which prioritizes patient safety. So in this case, agitation will be our answer. Why? Because if he remains agitated, if his agitation keeps on increasing, he can harm himself as well as other patients or the staff members. Also, because till he's agitated, we won't be able to, help him to sleep, give him some medication, or offer him food because he will not listen to anyone. So, if we want to solve other three problems, we have to first bring his agitation down. So, the finding which requires immediate follow up is agitation. That is the correct answer. I hope it is clear for those who if this answer is still not clear, you can ping me, you can drop a message. And for regular discussion of such next gen questions to help you out for any other assistance in your NCLEX, CBT, DH, or any other exam, you can contact me through my channel or Insta profile. Both are under the name of NCLEX Mentora. Keep following and keep studying.